Hello everyone, my name is Amber Jensen. I'm here, I'm going to do my cardiovascular and pulmonary assessment. I'm here with my patient. I would come into the room, foam my hands, make sure you provide privacy, check the orientation of your patient. Can you tell me your name and your date of birth?
My name is CJ and I was born in 02/22/2000.
Okay, do you know what year it is?
2018.
Okay, perfect. So on your assessment, make sure you let your patient know that you're going to assess their heart and their lungs. You're going to want to visualize your patient, making sure that as they're breathing, there's no abnormalities, there's no struggle, they're not using any accessory muscles, anything like that. You're going to also want to look for symmetry, so their shoulders, their lungs, look at their lung capacity and cage, make sure that they're even. You're going to want to kind of palpate to see if there are any masses or lumps or anything like that. And just kind of do it in the way that you would be listening to the lungs in that pattern. Feeling for any masses or lumps. And there are none. Then you would listen to your patient. So I'm going to listen to you. I'm going to have you take some big deep breaths in and out. And then as I move my stethoscope, just take some big breaths in and out, okay? Nothing abnormal, no wheezing or crackles or anything like that. You're then going to want to have your patient turn around so you can listen to them posteriorly. So here again, you're going to want to observe your patient's back, see if there's any abnormalities. Feel your patient again, checking for any masses or anything like that. There is not. You're also going to want to percuss to see if you hear any dullness or anything like that in the lungs. And again, listening for anything abnormal, any tenderness or pain, anything like that.
No.
Perfect. I'm again going to listen to you, just have you take some big deep breaths as I move my stethoscope. Perfect. So you're going to want to do a few more tests here just to check for any abnormalities. Excuse me. So you're going to want to check for the whispered test for the pectoral liquoi and then the bronchiophony and then the edgeophony. And so you're going to want them to do a whispered test and kind of like say 1, 2, 3. You're going to want them to do like an E noise and listening for any abnormalities. It should sound just like a muffled sound. It shouldn't change really the sound of what they're saying to you. So you're going to want to do that if you feel that there's any abnormalities in the patient's lungs. So I'm going to move to my to the heart. So again, you're going to want to before your assessment, look at your patient's chest to make sure there's no abnormalities or masses. And then I'm going to go ahead and feel the carotid artery here to make sure I feel it and that it's nice and strong. And it is. It's better to feel down lower so we're not compressing anything up top. Excuse me. So I'm going to go ahead and listen to you. You can just breathe normally, okay? So you're going to want to listen to the aortic, pulmonic, tricuspid, and the mitral valve. Then you're on the mitral valve, you're going to want to listen to the pulse and do your apical pulse. So you're going to want to listen for your apical pulse for a full minute to get an accurate reading. Excuse me. And then that is the end of my assessment. Thank you so much.